Hi, welcome to Navajo County Connection. I'm your host, Supervisor Dawnafe Whitesinger from District 5. Today, our guest is Amy Stradling with Navajo County Public Health. I think one of the things that we have certainly seen within the past year is maybe we're talking more about mental health and how we've been impacted by the pandemic, how maybe young people have been impacted by the pandemic. I know that many people have lost their jobs and many children have been home, online school, and certainly there have been many factors that have impacted our communities and our young people along the lines of public health or mental health. So here we have Amy Stradling to talk to us about that today. First, can we start with just you introducing yourself and telling a little bit about what you do? And
Sure. I'm Amy Stradling and I work for Navajo County Public Health. I have been there about 18 years now, and I'm a division manager for them with several of the prevention and outreach educational programs. So we have a teen health program that serves the community in the schools. We have an opioid prevention program that offers substance abuse education in the schools and the community and tries to address that stigma. We have we formerly had a nutrition program that worked with the community on healthier access to healthier foods. And we have our WIC program. So several community education programs under my division. And so we are really looking from a standpoint of prevention and education. How can we be there for our children, our schools, our communities at this time?
So there's lots of, I guess, a comprehensive, the public health services really creates a comprehensive approach to being able to serve the public and providing a variety of programs to ensure that we're helping and supporting the public. So I appreciate that. And I appreciate the introduction and certainly you being here today. Mental health is very important, and thinking about how does Navajo County respond to that? And when we think about prioritization, how does mental health rank in priority for Navajo County?
So when we first identified that mental health was such a big concern in our community is in 2018 we did a community health assessment, and we had over 1,200 community residents that participated in a survey to rank the top 5 priorities that they were most concerned about. Substance abuse disorder was number 1, poverty was number 2, mental and emotional health was number 3, chronic disease was number 4, and sexually transmitted infections was number 5. Recently, the hospital Summit Healthcare just updated this community health assessment in 2020, and it flip-flopped where mental health became the top 2 priority that our residents reported being concerned about. As you are aware, our schools have reached out to us at Public Health and said, we are tapped, we're trying to understand this crisis and manage the best way that we can, but we also need to support our families and our youth and our staff. How can we better do this? We do not have specific funding for mental health currently, so we're just looking at how can we help to identify resources, how can we talk to our schools and community to better understand their needs, and how can we really use the services and resources that we already have to maximize that outreach and input and impact on our residents.
So I think that each of us can probably take a, just an assessment of our own life in the past year and our own mental well-being, that there were times that we were all tried in some capacity, that we were stretched in ways that we hadn't been, or maybe challenged, or had to think about things in a different way. And certainly all of those things can add stress to our lives. And this conversation about how do we better serve young people, or being able to provide some of the best supports to be able to help young people work through those challenges. and talking to school systems and others who serve young people, that was a concern for them and continues to be a concern. And certainly that we've had school systems who have gone through very challenging times dealing with students and mental health issues, and that we want to continue to be a resource. So when we think about the future and what does Navajo County think of this, or how they are looking forward, I know that there's a committee that's been developed. What is that committee and what does it do?
So it's the Community Council on Mental Health. It consists, it was developed in 2018 when mental health was first identified by the community as this is something that we need to identify resources and support around. We know that mental health and behavioral health providers nationwide is kind of a crisis, it's kind of a gap. So we started working, but the committee continued to change leadership hands, and it's kind of an overwhelming, overarching problem to take on all by yourself. So we came up with the plan that a couple of us would work together as the co-chair, making it not quite so overwhelming since we all have other jobs and other priorities that we have to focus on as well. So we started the Mental Health Coalition, and with our 2020 revisions, we have already got an action plan in place of measurable outcomes that we can do to make a difference in the community. The first one is just prior to COVID in 2019, we provided a stress and resiliency management training at Heber Overguard. So we did a parent night, and parents came and learned how to talk to their youth, especially around stressful situations, around peer pressure, around some healthy coping mechanisms. And then we did a assembly style where all of the students from the Heber Overguard High School came and participated in an assembly on stress resiliency and management. It was very well received. Several of the schools were just starting to request this. And then COVID kind of came along, and so schools became overwhelmed just at that fact. So we're hoping to re-implement this program. We have Kim O'Farrell and Rhonda Krause taking the lead on that. They plan on continuing to do the parent educational sessions as well as the assemblies for the students. It will provide resources and coping skills, also point out some of the signs that someone may be struggling with mental health issues. It may just be anxiety, it may just be from a traumatic stress, like a test that's coming up that has them severely nervous. So it may not be an actual mental health diagnosis. The second one is a program that Becky Montoya with the Blue Ridge School District started last year because she continued to see a need for resources around mental health. So it's called Creating Safe Spaces. It's more of a peer-driven educational support program. So she brings youth in 6th through 8th grade that can kind of pair up. They can be educated on warning signs, how to be more supportive. If your friend does talk to you about self-harm or other stresses, how to connect them with that warm handoff and best support them in a way that's caring. It has comfort kits, so any student can receive the comfort kit. She mentioned there was a family that lost their home in a house fire. And so just reaching out to say, hey, someone cares about you. It consists of a letter that the youth write. It consists of just doodling pads, a blanket, a stuffed animal to cuddle up with. So that's the second part of the program. And the first training is on June 1st, and she's really hoping that community members, professionals will come forward, but also bring the youth. She's looking for sponsorships to make this program feasible because it does cost for the comfort kit. So everybody that attends the training, right now the training's free of charge, but they'll bring the information and things to put together that comfort kit at the end of the training. The third component that we're really focusing on is the mental health first aid. So getting certified trainers in our area so that we can go out to the schools, we can go out to the community and provide these mental health first aid. So they have a youth curriculum, and currently, to my knowledge, Becky Montoya is the only one that we have in Navajo County that is certified, trained, and they really recommend that you pair up as two, or you can at least see larger group sizes. So we're really in hopes of working with our community to find funding to make that happen and increase the mental health first aid trainers. It's anywhere from about $2,500 to $4,000 a training. So every individual that goes through that training. Change Point currently has one adult mental health first aid trainer, but they would also like to increase. So that's kind of something that we're really working on with Change Point, the Stronger as One Coalition, and Navajo County Public Health, is how can we form these collaborations that we can look for trainers, and they don't have to be have a background in counseling or anything mental health related. They're just those that are comfortable facilitating in the community and can help share this important message on recognizing the warning signs, how to ask them the questions that nobody likes to ask. Are you considering self-harm? Are you planning a suicide? Do you have a date? Do you have a form that you would use or a weapon? So those are uncomfortable subject matters for everybody, but the more that we can do that and kind of take that stigma away from talking about it, and realize, like you said, every one of us has probably struggled in one way or another this past year. So
I think, in listening to you, that there's certainly an effort to be able to reach young people, that, when we think about the initial phase of being able to provide young people skills, and be, I guess, helping other schools and other staff members and other community members have those resources, is something that you're working on now, and being able to connect with individuals. And so if there are people who are interested, to certainly reach out to you. I think even thinking about how important it is for community members to just have that awareness, how important we all are to being able to support our young people and one another as neighbors and friends. Certainly mental health is not something that just impacts young people, but we certainly want to be proactive in helping our youngest population to be able to understand and develop those coping skills that they'll need to enhance their life and helping them in their future. I know that, challenges are part of life, and there are times that we might not understand how to deal with those things. So strengthening those skills and giving those skills to young people is quite a benefit and would benefit our families and our communities. So certainly something to be commended, and I hope that more people consider participating, and so we can reach more young people and helping them develop those particular skills. So when we look, you did mention a lot about, okay, these are some of the plans that we have for the future. Are there any other ideas when we think about Navajo County, and what does the future of mental health services look like? What does that look like to you?
So we have our teen health program that goes into the schools, and they provide a whole curriculum of positive youth development. So our curriculum is anywhere from like 8 to 14 sessions. So every week they're seeing the same friendly, familiar face as a trusted adult, to teach them all about their bodies, all about life skills, all about mindfulness, all about healthy relationships and how that looks. And one thing that we found this year is, number one, it was harder to get into the schools because of their situations. But a lot of times the school and this program, these are the trusted adults that the youth rely on. And so it's how can we continue to connect them? Not all of them have that support system at home to have the tools and resources that they need to have healthy coping mechanisms. So it's just really looking at how can we help our community and support them in this difficult time, but still get these programs and resources out to those who are in need. One thing that we have done is we have created a mental health coordinator position. So we recently filled that with Sierra Hensley. So she'll be working directly with some of the schools and things. She will be trying to find funding for this mental health first aid training, and really making that her number one priority, talking to our existing resources and saying, what's the referral process? What types of insurance do you have? What's your capacity levels? And making sure that we keep a current list of referrals. Something that the Winslow schools just started is a behavioral health council on their own. So we're so excited. They're just getting ready to have their second meeting next week. But that's something that we're participating in, and we would like to advocate additional schools to kind of be that champion individually, and then we can all come together as community, from town and city council members to board of supervisors, and say, how can we help support you? We are part of this community. We are invested in the health and wellness of our youth especially. They are our future. And so that's something that we would like to see more of. We're participating in training and identifying resources. But the biggest thing is just to really identify that sustainable funding to kind of take this program to the next level so that we can really have that dedicated staff, that dedicated resources to offer the community. And we know that, now it's needed more than ever, and that sustainability piece is huge. We're also offering it from a prevention and education, but it's really finding additional providers and counselors and even ways to look at earlier interventions and not waiting till it becomes a behavioral health or mental health crisis to refer to providers. So it's really a lot about the education and identifying resources for us at Navajo County, looking for sustainable funding sources, and then just partnering with our schools and our hospitals and our community stakeholders.
I think it's important in thinking about going back to that survey that, taking an assessment of the community and understanding their viewpoint of what are those things that challenge you and what are those things that you feel that we should be prioritizing, and to hear that, there's been a shift and that mental health has become, a top priority for the community, that they feel that's something that we need to spend time and attention to. And so during the pandemic, with the concerns of school systems and families, that we started this discussion about, well, how do we better look at this? Because I think one of the things that was really difficult for schools was, who do we reach out to if we have a young person who is considering self-harm? What does that process look like? And so to be given a phone number is sometimes really difficult, but sometimes that's the lifeline that you need. So I know that there are many steps that we're working towards to be able to best serve the public, and I appreciate that, and I know that our communities appreciate that, in being able to invest back into our young people and helping them to develop those important skills that are needed. So in thinking about resources, so if individuals are looking for resources, what do they do?
So we have a resource list that we can connect them with at Navajo County Public Health, and I can share that as well. However, one of the main things is the suicide prevention lifeline, and the number is 1-800-273-8255. So just really kind of Googling. A lot of these resources, when you Google them into a search, they can disappear. So if you are in a situation where you're afraid, You don't want somebody to see what you're Googling in your search. A lot of these disappear in the search history. The Teen Lifeline is one that we use a lot in the schools because it's teens that have been trained. So it's not like they're getting an adult that they say, oh, they don't understand, they haven't been in my shoes, things were different when they were growing up. But they're a real teen on the other end that may have just dealt with the same issue last week, and then they are guided by trained professionals and counselors. So they can call or text to 602-248-8336. And then the Arizona Crisis Services. But we also have local services through ChangePoint. We have Community Bridges. We have the NAMI program, which is the National Alliance on Mental Illness. They beg people to come to their support group and learn how to deal with mental illness and how to talk about it. And it's not just for those that may be struggling, but also family members, because it can be a lot. And we are seeing a lot of just lingering effects of COVID, not only mentally. We're seeing an increase in suicides, we're seeing an increase in homicides, we're seeing an increase in substance abuse overdoses. So really looking at how can we come at from a collective angle and really make sure that we're collaborating so we can address these co-occurring disorders that may be occurring. We're starting, unfortunately, a fatality review team so that we can look at real-time data here locally and what is existing in our community that we can tap into, what are our gaps, and what kind of recommendations can we make as a community, who else do we need to bring to the table to ensure this gets addressed and that we can truly impact these numbers and get them started declining again instead of inclining. So just really how can we support our community as a whole holistic approach, and especially our youth. Some of the schools just have us setting up little infographics like it's about test time, here's some healthy ways that you can study, you can do your deep breathing, some ways that you can better manage the stress of a test. So things like that, just any way that we can be there as a support system. They can actually absolutely reach out to public health and we will help connect them however we can with any of our programs. We're also looking at a school liaison program, which will give each school a expert in public health that they can reach out to. And so they can be connected automatically with one person that's local in their area. So if they need brochures that afternoon, they can run them right over and not have to go through a process of 5 different people. So we're pretty excited about that program as well.
That is a benefit, and it helps with efficiency and being able to help a school contact with one person and being able to find those resources that they might potentially need. But I think that when we think about mental health, there's probably a lot of different feelings that come up. Some people may embrace that idea that it's important for us to make that a priority. Others might not feel like that is, certainly something that we should be putting at the forefront. Non-issue, all these different types of conversation, and that can go into a completely different discussion. But I think one of the things when we think about on a communal level, why is it so important for us to deal with mental health and confront it, and being able to provide some of those resources that might be able to help individuals prior to having mental health issues or needing mental health support, in being proactive in thinking about our young people, but there are also, those young people who are struggling right now, and being able to direct individuals to getting the appropriate resources. So there's so many layers to being able to help in some capacity, so that we're able to strengthen our communities. I think, we all know that when we're strong individuals, that we can be better parents, better friends, and so it's a benefit for all of us to have a strong mental well-being. And so we hope that, by helping to build a stronger community, that we can continue to be a resource. So are there any last comments before we wrap up?
I think the final thing that I would say is it's important with substance abuse, with mental health issues, to realize this is not something someone chooses. They are both diseases. They can both be brought on by traumatic events that may have not been dealt with. So it's important as a community that we be kind, and that we realize that it's an illness just like cancer or diabetes, and getting those important connections and resources from the beginning and being able to talk about it openly is very important.
I appreciate that reminder. It is very important for all of us to be kind and to be patient, and to be a little forgiving, and to be a strength to one another. I think oftentimes that's probably all we need when we're struggling, is that we just need someone to be able to say that they're willing to help you, or that they're willing to listen to your story, or they're willing to help you to get to the next step. So we can all do our part. So thank you. I appreciate all of you joining us today and talking about mental health in our community, and how we can better support our young people and those who might be struggling. And we hope that you enjoy the spring season, and we will see you next month.